Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another episode of Lunch and Learn with Dr. Pierre. I'm your host, Dr. Pierre, your favorite board-certified internist, founder of drpierre.com, as well as the CEO of Pierre Medical Consulting, helping you empower yourself with better health with the #1 podcast for patient advocacy, education, and affirmation. This week, we bring you an episode on the solo tip with yours truly, and I'm going to be discussing my role as the patient in this game of healthcare, which I've kind of had to endure for the past 3 months, depending on when you're listening to this episode, especially if you're listening to this fresh. Past 3 months, I was in the role of the patient, and I'm going to be talking about the ups and the downs and what I've learned throughout this process, especially being a physician who takes care of quite a few patients. Sometimes it's easy to forget how to put yourself in one shoe, but literally and figuratively, I had to do that, and actually I had to take myself out of my shoes just to get that better perspective of how some of my patients are faring on a day-to-day basis, especially when they leave the vicinity that I'm taking care of them in. Like always, if you have not had a chance, remember to subscribe to the podcast. Leave us a 5-star review. Let us know what you think about today's podcast episode. And if you are a friend of the show, please make sure you send this out to 1 or 10 people and let them know they should do the same thing here. So let's get ready for another amazing episode here on the Lunch and Learn with Dr. Barry. One of the sponsors for the Lunch and Learn Community Podcast is the Lunch and Learn Community Store, where you can find t-shirts, sweatshirts, coffee mugs, stickers, and wristbands with the motto, empower yourself for better health. Remember, 50% of all proceeds will go to the 5-Star Scholarship Foundation, where we give out college scholarships to deserving high school seniors across the country. Thus far, we have given out over 20 deserving scholarships to students across the country. So again, 50% of the proceeds will be blessed to the 5-Star Scholarship Foundation. And today you can get the coupon code LUNCH20. You can get 20% off your purchase, and you support these high school students across the country. Again, the Lunch and Learn Community Store is at shop.drbarrypierre.com, and the coupon code is LUNCH20. What's going on, guys? So to start off, I want to talk about what my initial thought process was. Like I said, like I kind of referenced in the intro, I've taken care of a lot of patients. I've taken care of patients in the hospital, patients outside the hospital, patients in nursing homes. So I have a good amount of experience in just taking care of patients, right? Like, again, I'm very fortunate in what I do and how well I do it. But when you're doing it, right, when you're on the other side, right, when you're the one standing over the bed, when you're the one prescribing medications, when you're the one that people come to see, it's such a different mindset of what you need to prepare for. So when I got to the situation I got to, and we'll be discussing, what happened. It was definitely an eye-opening experience kind of all around. And I'm going to talk a little bit about, what I learned throughout the process and what I continue to hope I'm going to be, take with me, especially now as I continue to take care of patients, especially now in a hospital setting and in the future. So I want to set the scene. I was out, I was taking my daughter, my oldest daughter, to tennis practice. And in doing so, I had to take my 2 twins out with me as well, too. My wife was actually out of town at a conference. So it was me solo dad, just out in tennis practice. And at one point, my son and my daughter had got out their scooter. And, they were playing around, doing okay, which wasn't bad. But then my son called himself taking off. He started running towards like the tennis gate, which those who know my kids love to run in like opposite directions. So his sister ran one way and he ran that way. So of course I have to chase after him because he's running towards the gate, right? Because I don't want him, running around the park, because that's a whole different issue I'm gonna have to deal with. So as I'm chasing him, it must have rained the night before, and there was this puddle, and I ended up slipping and falling. And fortunately for me, when he saw that I slipped and fell, he turned around, he did some smiling, and then he kind of turned away from the gate and started running back towards his sisters, which was great for me. But of course, I'm out there and I'm gonna slip and fell, and pride is crazy, right? My pride is like hurt a little bit, but that was okay, right? Because I played it off, so I thought. I got up, I kind of limped it off, and it was hurting. I could tell you, my leg was hurting. It was swollen. It was painful, especially at that time because my daughter still had tennis practice, right? So I couldn't go anywhere. So I had to put him back in his little seat, the crib seat, whatever you call those things, and kind of finish out my day. And as I'm getting home, as it's time for me to go home, just walking to the car was so much more unbearable than it was before, right? So I was like, ooh, I really definitely did a number on my ankle. Because I thought, right? I thought I just sprained my ankle. It was a good night sprain. I'm going to get home. I'm going to get some rest. And I'm going to be all good. Get home. Again, this is the weekend. So this is a Saturday. Fortunately for me, I didn't have to work that weekend anyway. So I get to work on Monday. And by this time, I have a brace. I've did the whole rice maneuver where I've rested and I've elevated and I've iced it. I've done all the things you're supposed to do, for ankle sprains. And it was better. I can tell you, from Saturday to Monday, the swelling was improved, but the pain was much better, right? So the pain was much better, but I just didn't like how the pain felt, especially at that time. So even because by this time my wife's back in town. And I ended up going to urgent care. Went to urgent care, got an x-ray done, got some pain medications. At the time, the x-rays were negative, right? And that's more of a foreshadowing aspect, right? So at the time, the x-rays are negative. So I figured, hey, you know what? I just a really bad sprain. Let me keep this brace on, keep this ice, and I'll be fine. So about 2 weeks go by. And by this time, the pain is essentially not even there. But the swelling really hasn't improved as much as I would expect the swelling to improve at this point. So I ended up running into one of my colleagues, who's a podiatrist, Dr. Davis, Elizabeth Davis, who I was like, hey, can I come see you in your office? Because, my ankle, I sprained it like a couple weeks ago, but the swelling is still really not getting any better than I would expect. So I go to see her, and lo and behold, what I thought was just going to be another sprain, and of course I ended up looking at the X-rays as a hospital physician, as a resident, even as a resident, but especially as a hospital physician. I'm so used to just looking at images myself. Again, may not be able to tell you exactly what's going on, but I can tell you when something's kind of abnormal. And I remember looking at my X-ray of the foot in her office, and before she could even tell me, I was like, oh, I broke it. Right, because I can see where the bone was supposed to be growing and supposed to be kind of in a straight line, and I can see it kind of peeled off, right? So, but apparently, and again, I looked at the X-ray that I did at the urgent care center, right, at the same way. So at that time, it was fine. There was no breaks, there was no splitting, there's nothing there. But this one was such an obvious split. So according to her, what she deemed would likely occur is that I probably had like a hairline fracture when I went to the urgent care center, but because it was a hairline fracture and wasn't picked up on the X-ray, and because of my job usually requires me to put on average about 6,000 to 8,000 steps a day, just kind of walking on it over and over and over again, essentially caused the hairline fracture to become a real fracture. So we go in and this was a Thursday, right? So this was like, for just to date myself, I think this was like July 11th or 12th. And I go in there thinking, I got a bad sprain. I'm probably going to get another wrist split or something else no, you have a break and we need a plan for surgery. Now, mind you, I'm not a novice in surgery. I've had orthopedic surgeries when I was in middle school. I've had surgeries on my ear when I was a child because I had a keloid formation there. So it wasn't like I was, new to the surgical game. It had been so long, especially as an adult, because again, remember that my last one, I was in like middle school. So I was like, between 12 and 15 years old when I last got my surgery. And here we are, we're over about a little bit under 20 years later, and we're talking about having surgery again. And so, of course, and I think my wife jinxed me at that time too, because I remember leaving for the doctor's appointment and her saying like, "Oh, what if she tells you have to have surgery?" Like I said, I'm not worried about it. I'm not gonna have surgery. I don't have to worry about it. But so she jinxed me, right? So shout out to Maria for jinxing me and wishing that surgery upon me, because I definitely had to get it. So I leave the doctor's office, and again, I had. Let me show you this to give you an idea how much I did not think that I didn't have surgery. I had ended up scheduling two doctor's appointments, one with Dr. Davis, the podiatrist, and then I had scheduled just a wellness exam with my regular primary care doctor, right? So here I go thinking I'm just going to leave this one doctor's office. She's going to tell me I have a sprain, keep doing what I'm doing. And then I was going to go to my doctor's office and just kind of get my routine blood work for my yearly exam to like, oh, no, you have a fracture. We need a plan for surgery. And me going to my next doctor like, oh, hey, by the way, I'm going to have surgery next week. So I just want to kind of let y'all know, right? So that was kind of the spin of things that happened like just that week. So here we go. We are planning for, mentally planning for surgery. And of course, I didn't realize how immediate she thought I needed to have this surgery. Because again, mind you, I have been walking on this foot for 2 weeks. By this time, there's no pain, no discomfort. It's just swollen. And I get a call from her office like, hey, Dr. Davis is scheduled for surgery on Monday. Like, get everything ready for Monday. Again, this is Thursday, y'all. It's either Thursday or Friday. So this is Thursday or Friday, and now I got like literally less than 2 days at most to get ready for surgery. So I do all that paperwork I need to do. I get my chest X-ray. I get all the pre-op level work that I'm so used to prescribing for my patients. But not used to, again, I wasn't used to actually having to go through the process. It was definitely something ordeal. And again, I was doing the surgery at the hospital I worked at too, right? So these were people I seen every day. But all of a sudden, I'm like, oh, hey, by the way, I got this paper because I'm going to be the one who's going to be here as a patient for surgery, right? So that's always a different look, right? Because now, the people who work there who are used to just me being a physician, now I'm the patient, right? So now they're having to coach me as they would coach any patient on what they do, what to not eat, and all the stuff that, again, I typically already knew, but it was good to see them really not break character in doing so. Fast forward, Monday comes around, and surgery time is here, right? So I decided, especially at that time, right, when I realized, hey, I'm about to have surgery and I'm about to go into this endeavor as a patient. Right? I said, maybe I should, kind of film this, right? So for anyone who actually follows me on Instagram or even my Facebook page, you're already aware of, where I went with this, right? So I call this I like to call the Back to Sneaker series, right? Because I remember her telling me that you were going to have this surgery and you're not going to be able to put any weight on your foot for like 4 to 6 weeks. Right, that means no tennis shoes, no nothing. So I figured I wanted to kind of document, the process of kind of going through what it meant to be a patient. Because again, like I said, it wasn't something that I was so used to. Again, I was used to taking care of patients, not used to being said patient. So again, if you follow me on Instagram, if you follow me on Facebook, you can actually catch a lot of video clips throughout the process of me kind of going through the motions as a patient. So lo and behold, we do the surgery. Surgery turns out absolutely amazing. And it was one of the surgeries where I didn't even have to stay overnight. So I went home immediately after, once I woke up and everything, immediately after the surgery. And I get home and, now I'm bed bound, right? So now here's a person who's used to walking 6,000 to 8,000 steps a day, who's used to going to the gym, who's used to being extremely active, and you're essentially saying, like, I have to adopt this very sedentary lifestyle. And oh my God, I could tell you, I used to, it was like pulling teeth sometimes, just trying to, break the cabin fever that was setting in. And again, this happened in like a course of a week or two, right? It didn't take very long for me to not do nothing, for me to start getting crazy. That I wasn't doing anything, to the point where like I was, doing stuff online and doing all the paperwork, everything I needed to catch up on, I caught up on. But I got so bored that I caught up on all the paperwork and stuff I needed to do in like a week and a half. Like it didn't take long for me to catch up on this stuff, right? Because I had so many hours in a day. I think I watched like 3 or 4 different Netflix series and rewatched a couple of other series, just because I had so much time doing so. So as I am going through the process of, being this non-weight bearing, patient, and dealing with the pain and the up and down of the pain. Because I can tell you, I remember when I first initially did the procedure, the pain after like the first couple of days was pretty manageable. I'm not I have pretty good pain tolerance in the first place, and I think that's why, because I was able to walk around with a broken fibula for like 2 weeks and not realize that it should be causing me pain. Kind of going through the motions of dealing with the pain control, dealing with crutches, and what I will tell you, probably one of the biggest things I realized as a patient is the fact that you're not allowed to bathe, right? Like that was a thing that I was so used to taking showers, and now I was being told I couldn't take a shower because the cast that I had on couldn't get wet. So I'll tell you a little secret. One of the most amazing Amazon purchases I've ever made, right? Again, I made a lot of Amazon purchases. One of the most amazing Amazon purchases I ever made was with, I ended up buying a waterproof cast. And it was a plastic cast that had like an airtight seal at the top. And when I tell you, being able to go from like using a towel to bathe myself to actually being able to sit in a shower, and again, I'm sitting at a shower, like it's a weird. By this time I got like a bath seat. It's a weird angle that I am sitting in, but it's enough so that I can sit in, prop my feet up, and just take a shower. And it was such a exhilarating experience that I was like, oh, like I can't believe like I take care of patients on a day-to-day basis. And one of the things I never like try to champion is for them to just take a shower. Like again, it's one thing to have the towel brought to you and you got a little bucket and you wipe it down. Like I said, because I went through that for, if I asked my wife, probably like a week or so. It wasn't long. It wasn't long before I realized that, oh, I'm not even gonna like feel myself if I don't get into the shower. So if I had to say, out of all the things that I did right as a patient, buying a waterproof cast was hands down one of the best investments. So again, fast forward. So by this time I got crutches. By this time I'm going through the process of using crutches at home to try to move around. My doctor had recommended me to get a scooter. Just to kind of be able to wheel around the doctor's appointments or wheel around the house, just so I wasn't, as tied to the crutches, especially because by this time, especially anyone who's had crutches for a long time, crutches hurt. They hurt your shoulders, and they're just not comfortable, right? So very tiring. So I needed to get a scooter. And again, and this is another scenario where I realized, like, wow, I definitely don't realize what my patients have to go through. Because I remember it taking almost 2 weeks to get a scooter from my insurance. And what made it worse is that it was 2 weeks for them to even process the prescription. And I remember calling at the end of the 2 weeks and be like, hey, have y'all processed this prescription yet? Oh, not yet. We'll prioritize it and we'll do it in our next business day. Mind you, I'm calling on a Friday because I'm asking like, hey, are you shipping this thing out today so I can get it and move around? Because by this time I am essentially done doing the crutch game, right? I'm done with the crutch game. I don't want no business of it. I had already reserved myself to the point where if I had to move with crutches, I'm not going anywhere. So by this time, I'm waiting for them. I called them. They're telling me it's about 1 or 2 more business days, and I know today's Friday, which means they're not even like thinking about me till like Monday or Tuesday. I said, you know what, forget it. I ended up going again because I love Amazon. Shout out to Amazon. And for those who don't know, I do have my own Amazon store. Link will be in the bio. Link will be in the show notes if you want to check that out. So I get the Amazon and I order my own scooter, guys. Like how crazy that as a patient that you would have to order your own products that you need to take care of yourself. outside a traditional, medical world, right? Because they just don't provide it, especially in that haste. So I remember this Amazon, y'all. So I remember ordering it on a Friday and getting it back by Sunday. So by Sunday, I had a thing that I was waiting for 2 weeks. I had gotten 2 days. So get the scooter and moving around. And by this time, again, I'm non-weight bearing. So I am not only non-weight bearing, not only not going anywhere, not only binging on all the TV shows, but I'm not working at this time. And I can't work because, again, the difficulty in me trying to get around with crutches would have been so bad. I was like, no, I'm not going to do it. I'm not going to do it to myself. So I ended up getting the scooter, getting the scooter to keep move around. And once I got comfortable, and, once my podiatrist, Dr. Davis, kind of gave me the green light, I went back to work. So it had been, I would say, about 6 weeks, right? So we're going on 6 weeks, almost 6 to 7 weeks now of not working, not, seeing patients or, dealing with I would say I was definitely dealing with my residents because I had to I had to do a few meetings from the comfort of my own home for some resident related issues. And just kind of going through that process and kind of getting back into it. So it took about 6 weeks for us to see the hospital again, which by that time I couldn't wait because, again, I was about to go stir crazy in my house, just waking up and eating and going back to the bed. And it was just stir crazy. I just couldn't do it anymore. So 6 weeks in, we start going to work. And we start, we're in a scooter, and everyone, especially would tell you that how much they love seeing me in a scooter because, I was able to move around a little bit better. I could tell you, like, I would go into patients' rooms, and the patients would spend more time asking me what happened to me versus me asking them why they're even in the hospital. So it was definitely a way that I could see that my patients learned to connect with me much better than they would have if I was just walking there on my own 2 feet. So I would spend a lot of time just talking to my patients, explaining to my patients like, hey, chasing after my kid, ended up slipping and falling. I thought it was okay. And then boom, it ended up being fractured and I had to have surgery. And by the way, like I just got here like a week ago, right? Because again, that's how fresh it was for a lot of people where I just started working and, they're seeing me in a scooter and they're saying like, oh my God, what happened? And kind of going through that process. It was a good icebreaker for a lot of my patients, but I could see that for them it was like, okay, all right, this doctor definitely knows what I'm going through because look, he's hurt as well, and he's still coming to work. So we're at work, we're getting used to it, and I think almost 2 months and some change go by before I'm able to walk or put weight on it, right? I'll just say that, right? Because I definitely was not walking. It took about, I say almost about 8 to 10 weeks of, being non-weight bearing to finally being able to put some weight on it. And let me tell you how humbled I got. Because I remember in my mind, this is how it went in my mind, that it had been so long that I was able to walk that the second I could walk, everything's going to be good. I'm going to be kind of running a marathon. Whoa, Lord. I remember putting my foot down the first time she told me like, oh yeah, you can just, you don't need a scooter anymore. You just put your feet down. And it felt like, and again, for those who've had any lower extremity injury, I'm pretty sure you understand what I'm talking about. It felt like a knife was like being stabbed through the bottom of my foot, and I could like feel it all the way up my leg. It was just such a terrible pain that I remember even questioning whether I was going to walk again, right? Like, that's how bad the pain was. Like, I started thinking to myself, like, I don't know if I'm going to be able to walk on this foot again, right? Like, I think this foot, like, really, maybe be done for, right? So, of course, I was hyperbolous at the time, and I ain't know no better, right? But, again, I was going through the motions of my patients, right? I'm thinking I wasn't even thinking in the eyes of a physician. I was thinking in the eyes of a patient, like, oh, my God, if it hurts this much to put the weight on it now, there's no way it's going to get any better. So that pain was such a humbling experience in that doctor's office, in Dr. Davis's office, that even though I was given the green light to be able to put weight on it, like I still waited another 2 weeks, y'all, before I can start. I started toe tapping at first, right? I started kind of, I'd be in a patient's room and I'd kind of lay it down just for a little bit. And just kind of sway back and forth until the pain got a little bit too much, and then I'd jump back on the scooter, and that was kind of my process for at least another 2 weeks until the pain got much better, a little bit better controlled, and I was able to kind of start walking around. And during this whole process, right, again, so we're almost about 10 weeks, right, 10 to 12 weeks. And I'm periodically following up with Dr. Davis, making sure everything is kind of going the direction it needs to go. And she was like, nope, you're going and you're progressing exactly how I would expect it to be. By the time my last appointment, which again was almost 12 to 13 weeks since the surgery, by the time my last appointment was done, I remember walking to her office. She was like, how are you feeling? I was like, you know what? The pain is better. A little bit swelling, but no really issues there. She's like, you know what? You've got my vote of confidence. You can go, right? So she said, you can just see me whenever you want. And that was some of the best words I ever heard, because now I knew that, my reign was a little bit more freer. I was able to, get my move on. She even gave me clearance to go back to the gym, right? So everything is looking absolutely amazing. And I remember as I filmed my last video for the Back to School series, right? So I remember filming my last video for the Back to School series and thinking to myself, guys, it's about time. I'm back in my sneakers officially, and I remember feeling this disconnect, right? I remember being attached to the world of a patient and understanding the ups and downs that the patients are going through, and now I was kind of stepping back into the world of a physician. And mind you, even as we speak today, I still got a limp. It still hurts a little bit. There's still swelling there, and funny. To note that she said that the swelling is probably not going to go down for a year. It's going to be a year before I can start seeing my ankles not being fat and swollen in my right foot again, right? So again, and I was glad she let me know, right? Because imagine if a month later this swelling was still here, I got worried or scared. So I recorded my last video, essentially telling everybody thank you for the well wishes and the support throughout the process. And I essentially kind of said, I'm done. And I got to here, and I got to the point where I said, everything I've done, I needed to do, and that chapter is essentially closed. So as I, kind of recap of everything we've talked about today, I was the doctor. I was, playing daddy daycare at the time, and I slipped and fell. And because I was playing doctor, I made the situation probably worse than it should have been, to the point where I needed surgery, right? Because I was playing doctor and I was able to fight through it, and I was able to, deal with the pain, especially initially. I was able to fight through it, and then ended up, lo and behold, I ended up causing worse damage than should have been. But the surgery went well. The post-operative course went well. Like I said, I do have this documented on my Instagram, so just go under my IGTV, and you'll see all of the episodes. And even better, right? Just for those who are keeping score, because I was so active, and I used to go to the gym, and because I used to do all those things there, I remember when she told me I couldn't do any of those stuff for 6 to 8 weeks. The first thing I thought about was oh my God, what am I gonna do about my weight, right? How am I gonna maintain my weight? So I ended up going on a low carb / keto diet, and I don't want to call it diet, let's say lifestyle, right? I ended up changing my lifestyle throughout this whole process, right? So throughout the whole process of being a patient, dealing with pain, dealing with rehab, treatments at the house, I was changing my lifestyle to accommodate the fact that I couldn't eat and exercise like I wanted to anymore, right? And it's done wonderful results. Like I said, I think I've lost, especially at this time we're recording, almost like 40 plus pounds. Again, in like a 3 month span. And I have an episode, I forget which number episode it was, where I talk about the keto diet. But so check that out if you have not had a chance. And so I lost, at the time I was recording, for sure over 40 pounds, just with that lifestyle change of low carb and keto related diet. So definitely, again, a silver lining in all of this fog from the injury and the surgery was that I was able to kind of make a diet change for the better. And, definitely thankful for that. And, all of the good comments I get for the weight loss is definitely a plus on my end. So I want to end this series really just kind of pleading out to, those who are in healthcare and taking care of patients in one way, shape, or form, to remember that there's a lot of different things that they go through as a patient that we sometimes take for granted because we're usually kind of just dealing with, what we see on the outside. And as a patient, understanding what, all of the ups and downs and pain control and, when can I do this? When can I do that? All of those questions and concerns are definitely something that I will be adding to my armamentarium and making sure that I can help adjust for my patients. Because that's really the name of the game, right? Like, how can I learn from this, right? Because it would make no sense. Yeah, it would make no sense if I went through this whole process and, when it was said and done and I was back in my sneakers, right? I didn't actually change any of my philosophy and my work ethic for my patients, right? It wouldn't make any sense in the world. So I'm definitely thankful for that. Thankful for my son for causing me to break my fibula in the first place and helping to open my eyes up to a different world that I was definitely on one side of the coin on, being the patient, the person who's taking care of someone, to flipping it and being on the side of the person who needs to be taken care of. So you guys have a great and blessed day or week. I'm going to see you guys next week. Thank you for getting to the end of the show. I am your host, Dr. Barry Pierre, host of the Lunch Learn with Dr. Barry, and this is another amazing episode that we like to bring to you week after week on betterment of empowering yourself for better health today. If you have not had a chance, please go ahead and subscribe to the show. If this is your first time listening, if you already listen and you've already subscribed, make sure to leave me a 5-star review because your support is absolutely important in keeping the show moving as it is. And if you have not had a chance and you want to check out today's show notes, always head over to lunchlearnpod.com. That is lunchlearnpod, all in one word.com, and you can get the access to my show notes for every single episode, but especially the one you just listened to. And I'm gonna see you guys next week. You guys be blessed. Bye.